Hello, welcome to the study guides for nurses. These are series of lectures aimed to help nursing students ace their nursing exam and at the same time be effective in their clinical training. As a nurse for 30 years, I felt that it's about time to give back to my profession. So here I am. I would like to share with you things that I've learned and in the clinical training and in the bedside, and hopefully this will translate into uh, better grades in your examination and you enjoying your clinical training. So as you could see, this is my first video and I'll be talking about acid-base imbalances. So, so when we talk about the acid-base imbalances, we talk about the disequilibration between the intracellular and the extracellular fluid. As you could see in the figure, I created a horizontal line which is representing the pH of the blood. So we know that the normal pH of the blood is between 7.35 to 7.45. I created the midpoint at 7.4 to make it a little bit easier for us. So anything, if the pH goes below 7.4 or less than 7.35, we consider that blood as acidotic. So there is acidosis if the pH is less than 0.74 or less than 7.35. In other words, there are less hydrogen ions, right? So there are less hydrogen ions, therefore the patient has acidosis. Now, there are two major organ systems that helps balance the acid-base imbalance in our system. And these are the lungs and the kidneys. So if the pH is less than 0.35 and if it's related to the lung issue, then therefore we call it respiratory acidosis. Similarly, if it's related to the kidney, we call it metabolic acidosis. On the other part of the spectrum, if the pH is greater than 7.4 or greater than 7.45, we consider the blood to be alkalotic. So at the same time, when we talk about hydrogen ions, so there are more hydrogen ions when the patient is alkalotic. As I mentioned on this spectrum, in the acidotic spectrum, as you could see, if it's associated with the lungs, we're going to have what we call respiratory alkalosis. And if it's associated with the kidney, we're going to call it metabolic alkalosis. So, what are the possible causes for all this? There are so many. Salicylate ingestion, so excessive salicylate injection. Patients who have COPD may tend to have respiratory acidosis. Patients who are diabetic may tend to have metabolic acidosis, especially if they're not controlled and they have too much glucose in the blood. And then, of course, renal problems and patients who have electrolyte imbalances. So, there are so many causes associated with acid base imbalances. That's the reason why, as nursing students, we need to be able to read an ABG and determine what acid base imbalance it is. We need to be able to understand what possible causes of the imbalance are, and then at the same time determine some interventions or some treatments. I know as a nurse, we can't order some interventions, but it would be better if we communicate with the physicians the possible interventions based on our assessment of the patient. So, those are the possible causes. As a matter of fact, we'll go into detail as we go to that particular video when we talk about the particular acid base imbalances. But for the purposes of this first video, we're just going to talk an overview of the possible factors associated with the acid base imbalance. So, In terms of compensation, as I mentioned earlier, there are two main organs that kind of work together hand in hand to help with the problem. So these are the lungs and in the kidneys. And if there is some acidosis issues, what the kidneys does is decrease the excretion of the bases. And if there is respiratory acidosis, then what the lung does is to get rid of as many CO2 as possible, right? And of course, it's happened the same thing as with alkalosis. So before we really go into how we're going to interpret our ABG, we need to determine the numbers. What are the normal values that we need to remember in order for us to make um, an interpretation of what we have in front of us, the ABG. Now, I have to say, I have to put caution here. The different organizations, different hospitals have different normal values. I recommend that when you do your training, you look at the hospital's common normal values for their ABGs. You can always see this in the patient's chart, or you can ask respiratory therapists, or you can ask the nurses that you're working with so that they're going to tell you what the normal value is. Um, the other thing I want to mention is depending on the hospital specific policies, you really have to follow that hospital policies. The other thing I also want to emphasize is whatever your teacher tells you in the classroom as the normal values, depending on the textbook that they're going to be using, use that when you're taking your examination. So let's start. For pH, 7.35 to 7.45. Now, the PaCO2, which is the partial CO2 tension, carbon dioxide tension. So, partial arterial carbon dioxide tension, they're measured in millimeter mercury. And the easiest way to remember, if you remember the pH, the normal pH, just get rid of the number 7 in front of them. That would be the normal value for your PaCO2. And then, of course, your bicarb, it's 22 to 26 millimeter mercury. And then, of course, you have your PaO2. I'm just using the normal range here that I'm familiar with. It's 80 to 100. I know some organization might say 90, 80 to 100. I guess to make it very simple, remember 100 millimeter mercury. And of course, there is this base excess and base deficit. It's either plus or minus 2. So we'll stop in this first video when we talk about acid imbalance. The next video that I'm going to be creating is how to interpret acid-base imbalance using the blood gases values that you're going to see in front of you. Okay, so I hope you stay around. Come back on my next video. I would love to share my experiences and tricks and tips that I've learned as a nurse for 30 years. Thank you.